This is One on One. Welcome back. I'm Steve Adubato. We're continuing a conversation we've been having with Bob Garrett, CEO, Hackensack Meridian Health. Bob, last time you joined us, we talked about a range of issues, including the plasma transfusion therapy. But I want to do this. I've said before that I've done a lot of physician leadership development. What does the physician of tomorrow need to look like to deal with the world of healthcare tomorrow, whatever that's going to look like?
Right. I think, first of all, let me give a big shout out to our physicians. They truly have been healthcare heroes, along with our nurses, our respiratory therapists, our frontline caregivers. I mean, I think when the book is written about COVID-19, they will all go down as true American heroes. I think the physician, as we look forward, the physician of the future is going to be one that's going to have to, show some flexibility in terms of how they deliver care. Some of it will be done remotely. Some of it will be done in person. I do think that, what this crisis, this pandemic has taught us is that, physicians need to be agile, and they certainly were agile. So, all hands on deck, so to speak. And, I think there's also more of a feeling of collaboration amongst physicians. Yep. So a lot of sharing of data. So as an example, our scientists in the Center for Discovery and Innovation work very, very closely with frontline clinicians, and they directed their research to areas that would really make a difference on
Did they share it?
They shared it. And, two great examples, which were unbelievable game changers for this pandemic, were early on, Dr. Perlin and his team at the Center for
David Perlin over at the Center for Discovery and Innovation. Go ahead. I'm sorry, Bob.
Correct. Over at that CDI, they developed a diagnostic test for COVID-19 really before most of these tests that are out now were out. The only other test that in the early part of this pandemic that was available to us was a test being run at the State Department of Health, which very quickly got overrun and with testing demand, and it took like 5 days, 7 days to get the turnaround. Dr. Perlin's test got approved. Well, first it got developed and approved within a week of the first patients coming to Hackensack Meridian. That was a huge game changer because so many patients we benefited by that test being administered so early. And then the second game changer was the convalescent plasma infusion, and that was a result of talk between Dr. Donato on the front lines at Hackensack Meridian and Dr. Perlin in the scientific world. And Dr. Donato said, "Listen, if you can put your scientists to work in developing this plasma serum, that's something that I think can help our COVID-19 patients right away." So they went to work on it very quickly and literally within weeks turned it around, and now it's been a big success story.
Before I let you go, Bob, real quick, and I want to disclose, as I did the last time Bob joined us, that Hackensack Meridian Health is one of the largest healthcare systems in the state, and also a big supporter of what we do, an underwriter of what we're doing. Bob, it's interesting. When we talk about collaboration, you mentioned that Dr. Perlin, Dr. Donato, sharing, collaborating. I mean, the hospital world is pretty competitive, okay? But I've heard Governor Cuomo talk about this. I've heard Governor Murphy. I know that you were right there next to him in one of the early press conferences. Do you believe that there's a different sense of quote unquote collaboration? Yes, there's competition, geographic, et cetera. But do you believe there's a new normal, new world for collaboration among and between hospitals and hospital systems? And if so, what does it look like?
Absolutely. We've been conferring almost on a daily basis with our colleagues out there in other healthcare systems. We're sharing best practices. We're talking through issues, whether it's about universal masking of patients and team members to how we're going to test patients and team members into the future. We're sharing all that information. So there's been great collaboration amongst health systems, amongst hospitals, which I think will become the new normal, and I welcome that. I think it's great. There's new collaboration between researchers. Scientists are sharing their breakthroughs, their scientific data, and there's new collaboration between the government and the private sector. So the working relationship between the hospitals and the Department of Health and the governor's office has been superb. And I know I want to give a shout out both to our commissioner of health and to the governor, because they've been really great. They've been responsive and very, very collaborative during this entire process.
One more quick question to Bob Garrett, the CEO of Hackensack Meridian Health, before I let you go, Bob. The federal government, very much involved from day one. The president, the particular federal agencies. There's so many federal agencies involved. To what degree does your healthcare system, does any healthcare system, hospitals, et cetera, need to interact and engage directly with the government? A, and B, how hard is it to do that?
Well, we have been engaging directly with the federal government, through calls, through Zoom video, et cetera. We've had the opportunity to talk to Secretary of Health and Human Services, Azar, through a couple of his deputies
As
well.
we do this program today, I just want to clarify, we're taping in the middle of May. I'm not doing commentary. I'm just saying we're in the middle of May.
Right.
Azar's there now.
Azar's there right now. Yeah. So we've been conferring with him. We've had the opportunities to confer with the FDA and the CDC as well. And even there's been even reach outs within the White House task force with Dr. Birx as well as others. Dr. Fauci, I think, was in communication with a couple of our scientists. So I wouldn't say it's every day, but I think throughout the pandemic, there's been, good interaction with the federal agencies as well.
Bob Garrett, the CEO of Hackensack Meridian Health, 17 hospitals, a range of other affiliated and connected healthcare operations that it's a big footprint. Bob, I want to thank you for joining us. We appreciate your time. Most importantly, to you and to all the folks at HMH and the network group on the front lines dealing with COVID-19. We wish you all the best and wish them the best. They are, as you said, the real heroes. Thank you, Bob.
Thank you so much, Steve. And we appreciate all the support for our healthcare heroes.
Well said. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by New Jersey Sharing Network, the Healthcare Foundation of New Jersey, the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, the New Jersey Economic Development Authority, NJM Insurance Group, Choose New Jersey, the Port Authority of New York and New Jersey, and by Wells Fargo. Promotional support provided by AM 970 The Answer and by Meadowlands Chamber. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.